How's it guys, and welcome back to my channel. My name is James. Today we're going to be doing dive medicine. Just kind of basic dive medicine. Unfortunately, we're going to have to deal with science and chemistry and physics and all that sort of thing, but just only exactly what you need to know. Initially, we will be just discussing gas and gas laws and how that applies to the earth and physics and height and depth. Then we're going to talk about diving and how diving is supposed to work. We're going to maybe touch on some dive tables and pressures and dive computers, and then we're going to jump straight into what kind of problems you could probably expect in dive medicine and how you're going to treat them. So let's jump straight in. So gas laws. The most important law for now is that when the pressure goes up, your volume goes down. And when your volume goes up, your pressure goes down. And so these move like a seesaw. The one goes up, the other goes down. That is the one important law. So when we are standing on the beach, we have an atmospheric pressure on us. So there's the air around the earth puts pressure onto your body from the sides, from the top, from the bottom. You don't feel it because we're very used to it, all right? But let's just say we have one atmosphere at sea level. So the earth is surrounded by one atmosphere, and that's what you're feeling when you're at sea level. If I were to take a balloon and fill it up with 1 liter of air, it would be however big 1 liter of air would be in a balloon at sea level. All right, so now there is the volume, which is 1 liter, and the pressure, which is 1 atmosphere. If we take that balloon all the way to the top of Mount Everest, would you expect the balloon to get bigger or smaller? So as we move up, our pressure drops, so our volume increases. There we go. So you could imagine the same thing happens, but in reverse when we take a balloon with 1 liter of air and put it in the ocean. Your pressure increases because now there's water on you. And if your pressure increases, your volume decreases, so it becomes smaller. But now there's still only 1 liter of air in that balloon. Let's just discuss air quickly. So air is made up of 21% oxygen, 71% nitrogen, and the other percent is other, whatever other might be, depending on where you live, I guess. When you are on Mount Everest, how much air is at the top of Mount Everest? It's the same. It's 21% oxygen and it's 71% nitrogen. The only difference is that you need to breathe in 5 liters of air to get the same amount as you would in 1 liter of air. And when you're scuba diving and you're all the way down at the bottom, the opposite applies. 1 breath of air could be equal to 5 or 10 breaths of air up at surface. So you are breathing in more air per breath, because remember, pressure and volume. If the pressure increases, your volume decreases. And so if I take 1 breath at say 40 meters, that is equivalent to, I don't know, maybe like 5 or 10 breaths at sea level. And so you can imagine how you're breathing in a lot more compressed air. So what would we call the partial pressure, or how much actual oxygen is in a liter of air, is much higher when it's compressed compared to when you're on sea level or when you are at Mount Everest, where it's just so much less pressure, and so your volume is much higher. And that's why you need to be breathing faster to get more air through your lungs. So the way that the atmospheres work is that for every 10 meters below sea level in the ocean or water, you get 1 extra atmosphere of pressure. At sea level, you have 1 atmosphere. At 10 meters down, you have 1 atmosphere plus 1 atmosphere of water pressure. So that's 2 atmospheres. So at 20 meters of water, you are at 3 atmospheres. So just take the 3 and plus 1. So it is a significant amount of pressure as you go down. As you can imagine, when you're under a whole bunch more pressure, the amount of air you're breathing in per breath increases, and so the partial pressure of the gases we breathe increase. We'll jump onto that later. The other law that we need to discuss is that the amount of pressure in the gases above liquid is proportional to how much gas is in a liquid. What that means is that whenever you open up a can of Coke, you go psh, and you hear that air coming out. That's because the pressure above the Coke has now dropped, and so now all the gas that's been stored in the liquid comes out of the liquid and into a gas form. So that's kind of how much pressure is on the gas above a liquid affects how much gas is absorbed into the liquid. And that's important when we're dealing with scuba diving or flying or people in space, because this affects how much gas is absorbed into the liquid, and that also affects the boiling point. Same reason why when you are much higher in terms of your altitude, the boiling point of water changes. how is diving supposed to work and how does this all work? What's supposed to happen is that you are meant to go down and you aren't meant to spend too long down there, because if you spend too long at certain depths, you have problems. So what problems might that be? Well, as we discussed with these laws, volume and pressure are inversely relationshiped towards each other. And so when you are very deep, you are breathing in a lot more air. You're breathing in a lot more oxygen, you're breathing a lot more nitrogen, and these cause problems. Once you are at 10 meters, you are now under 2 atmospheres of pressure. So now you aren't breathing in 0.21 bars of oxygen, you're actually breathing in 0.42 bars. So do you see how the kind of like the percent of oxygen has now gone from 21% to 42% at 10 meters. And then at 20 meters, it goes up again, another 0.21 and another 0.21. So that when you're sitting at like 30, 40, 50 meters, you are breathing in almost 100% oxygen, well, 100%, but the partial pressure of oxygen increases so much. And as we had said, is that the pressure in the gas above the liquid is proportional to how much of that gas is absorbed by the liquid. That when you are breathing compressed air at different depths, you are absorbing different amounts of gases. So when you're deeper, you will absorb more oxygen, you will absorb more nitrogen. And you can imagine the complications that go along with having more oxygen in your blood and more nitrogen in your blood. And these are the things that we're going to be discussing. And these are where things go wrong. So let's jump into how diving is supposed to work. So you are supposed to be qualified. You're supposed to know what you're doing. And you should be having a dive computer, because these are the things that save our lives. And then there are dive tables. I assume you don't know exactly what diving is or how it's supposed to work. You are supposed to plan your dive and dive your plan. That's kind of the phrase we say, is because we need to know what we're doing when we're out of the water, so we know what we're doing in the water. So there's something called a dive table. For me to summarize this in like 5 seconds, is that at certain depths, you can only be there for certain lengths of time safely. So if I go down to 10 meters, I can spend like 2 hours at 10 meters and never absorb too much nitrogen to have a problem. And after 2 hours, I would have to come up, but my tank would run out of air. Or you can go down to 40 meters and you can spend 8 minutes. So do you see how at 10 meters or 12 meters, I can spend 2 hours? At 40 meters, I can spend 8 minutes. How a dive could work is you jump off your boat and you go all the way down to 40 meters, which is kind of the maximum of like recreational diving, which is what we're talking about. And you can spend 8 minutes there. Then you need to come up to 30 meters and you can probably spend like 10 minutes there. Then you can go up to like 20 meters and spend like 5 minutes there, or 20 minutes there. And so you're gradually moving up and up and up. So you go all the way to the bottom and you move up a bit and up a bit and up a bit. And that's how you avoid taking on too much nitrogen. If you take too much nitrogen on, it will take you too long to then get rid of that nitrogen. What typically happens is that when you're diving nowadays, you are staying out of the place where you're going to have serious issues with nitrogen, as long as you follow whatever your watch is telling you. If you go beyond what the watch wants you to do, which is pretty much what happens, is that you jump in the water, you go down to 30, 40 meters, and the watch will have a timer on, like 2 minutes. Or let's say you jump off and it goes, and you go down to 40 meters, your watch will say 8 minutes on. And then it'll go to 7, 6, 5, and it will slowly drop. And just as it drops, you then move up to 35 meters, and then that timer will go up, because you have more time at that depth, and then it will drop from like 20 to 15 to 10, and then at 10 you go up again to like 20 meters, and then that timer goes up again, because you have more time at that depth. Because the more pressure, the more gas you take on, the less pressure, the less gas you take on. If you go beyond that timer on your watch, you're going to have to do mandatory stops at specific levels. So you might, let's say you go down to 40 meters for like 20 minutes, because you would have enough air to do it, but you are going to have to do a decompression stop. And so we dive so that we don't have to do mandatory decompression stops, even though it's recommended to do a stop at 5 meters for 3 minutes, just in case. And so if you go to like 40 meters for like 20 minutes, you might have to stop at like 15 or 20 meters for about 20 minutes. And then you might have to stop at like 5 meters for 20 minutes to half an hour, depending on what's happened. These watches save lives. And so what can even happen is the watch tells you to stop or to go or to like do whatever, and you don't listen to it a couple of times, times, it literally just switches off and says, I can't help you anymore because you're not listening to me. And so because they're so calibrated, you have to listen to what they're saying. They will also tell you when you're moving up too fast. Why is this all a problem? All right. So what happens is that when you're diving on oxygen, you're on 71% nitrogen and you're on 21% oxygen. What this means is that you are going to take on more nitrogen than oxygen. The problem with nitrogen is that it dissolves into our blood. And so when we go deep down, it gets absorbed, and then when we come out, it then comes out of our blood. But we don't want it to come out into a gas in our bloodstream. We want it to come out when we breathe out. So we then have to slowly come up, and that's why you have a computer that'll tell you to not go up too fast. But if you stay too deep and you take on too much nitrogen and then you come up, or you come up too fast, it's kind of like when you open up a can, it goes psh, and all the bubbles come out. That's what happens to your blood, because the pressure and volume, and because the other law that we discussed, which was the amount of pressure in the gas above the liquid is proportionate to how much gas has been absorbed by the liquid. And so when that pressure above the liquid, which is the atmospheres, drop as you come up too quickly, that nitrogen in your blood can then become a gas. And then you have gas in your bloodstream, and then you can have a stroke. That's called DCI, which is decompression illness, or the bends. There's multiple names for it. But that is when you have too much nitrogen in your body and you come up too fast and it comes out. That can be symptoms of sore joints, stroke, death. And as you can imagine, how would you fix this problem? Because they've had lots of pressure down at the bottom of the ocean, now have come up too quickly, you put them back in that pressure, and that would be a decompression chamber, and that is out of the scope of this video. So what else can happen? So another issue that you can have when you're diving is that you can have too much oxygen, which will cause oxygen toxicity, which will cause you to have a seizure. And that happens when you have a partial pressure of oxygen of 1.6. So at sea level, we're on 0.21 bars or whatever of oxygen, and that's the partial pressure of oxygen, or 21%. And when we go down 10 meters, it goes to 0.24, and it goes down, down, down. And the point in which you will get oxygen toxicity is when you have a partial pressure of 1.6. So that is at 70 or 80 meters. That's extremely deep, and you're not going to go that deep on air, because remember, at 40 meters, you have 8 minutes. I couldn't imagine the minute you'll have at 80 meters, or you're going to have problems. And so what you will find in diving or scuba diving is that people will have mixed gas. And what mixed gas does is that it allows you to change how much time you have at certain depths. Because there's so much nitrogen, and that oxygen is only a problem at like 80 meters, we can decrease how much nitrogen is in the air we're breathing so that the nitrogen doesn't become a problem, but then we increase the oxygen. So it limits how deep we can go, but it increases how long we can be there for. So if we want to dive at 20 meters or 30 meters, we can increase our bottom time, which is how much time we had at the depth we want to be diving, by adding in more oxygen and taking out nitrogen. There's other like trimixes where they put like helium and other things in there, but we're not diving into that either. Pun. And so we're going to be just discussing that they do mix nitrogen and oxygen at different levels. That's probably the one that you're most likely going to come across. But now what this means is that because they're dropping how much nitrogen is in the air, they increase the amount of oxygen, which means that you have a higher chance of oxygen toxicity, which will cause seizures and death. The way you treat oxygen toxicity is you just remove the oxygen and put them on air and ventilate them, because that'll immediately bring their oxygen down to normal, because they have too much oxygen. And the nitrogen, when you have too much nitrogen on board, when they have come up too fast, or they haven't dived the plan, or they haven't listened to their watch, then they're going to have too much nitrogen on board, so they will be bent is the word, or they will have DCI, and so that will then cause longer problems, and then you need to go into a dive chamber. There is nothing else you can do for these patients. When you are dealing with a patient who has been diving and now you're having problems, what should you be thinking? What should you be doing? They can obviously be shot or stabbed, bitten by a shark, or hit by a grenade while they're scuba diving, but what's more likely going to happen is that they're going to have problems with their gases. They're going to have too much nitrogen or too much oxygen or too little oxygen because they've been drowning. And so you need to know what they dived or how they dived, What's also important is that if they dive now and then they come up to the surface and then dive again and they come into the surface and they dive again, it's kind of like a yo-yo diving, that then you take on a lot of nitrogen and the computer in your watch is going to complain because it doesn't like that and it's not good for you. And the thing that's going to really help you or help the doctors or the specialists who deal with dive medicine all the time is to have their dive computer and know what depth they dive to. Because how do I put you into a compression chamber not knowing how deep you were? Because then I don't know how much nitrogen you've taken on. And then I don't know how long I have to keep you at what depth for what length of time. We really want to know how deep have they been diving, how long have they been diving. If you can keep this information, the dive watch will have all that information. So keep the dive watch on the patient, because then the doctors and specialists can then deal with that. If they have DCI, you can put them on high flow oxygen. You keep them flat. You keep them flat because there's now bubbles in their blood. You want to keep the bubbles from reaching the head or the heart or the lungs. So you can even put them in a Trendelenburg position, which puts their feet above their head. And that means that the gravity or the bubbles will go up, which will go up towards their feet. Don't make them walk. Don't make them do any sort of exercise. They must just rest, calm. They might be in pain. You can deal with their pain. And so those would be the two major issues with patients who go diving. Guys, I hope this was useful. Sorry if it's a bit long. If you do have any questions, please drop them at the bottom, and I'd love to know if you guys have ever had to deal with a patient with DCI, or if you've ever dealt with a patient with oxygen toxicity, all these fascinating things. And please, if you did enjoy this, please hit like and subscribe, and we'll see you in the next video. Bye for now.